And good morning. It's December 19, 2023. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. Our patient is actually from Florida. He's 81 years old, and today is his birthday. So happy birthday. He's getting his back fixed for his birthday. Wonderful. He was actually born during World War II. We were just talking about that before surgery. So we're going to fix 2 discs. He's got lots of degenerated discs on his MRI and X-ray. You can see all the degeneration and bone spurs. Our goal is not to make the spine look pretty. Our goal is to get rid of back pain and leg symptoms, okay? And to do that, we have to get to the source of pain. And in his case, he's got 2 discs and 6 facet joints that are causing his pain. That is the L4-5, L5-S1 discs, and the facets are the 3-4-4-5-5-1 bilateral. All right, Jordan, that looks pretty good. There's some, the foramen at 5-1 though, it looks like we're off. I think we have some scoliosis. Let's see if we can improve 5-1. We may not be able to, but let's try. In the meantime, while Jordan is working on, I think that's better, Jordan. I really do. Let's keep that. I'll just say a word about the X-ray machine. It's very important to have the X-ray machine lined up properly at the very outset of surgery. If you don't have the X-ray machine lined up properly, then your navigation will be wrong. You'll be somewhere you're not supposed to be. So it's very important that you understand the anatomy and that everything lines up properly. All right, heading down to L5-S1. So the first thing that I do is make sure that the X-ray machine's lined up properly before I use that information to navigate. Think about the old days when sailors used the stars to navigate, right, on a ship. Well, if they didn't get the stars right, then they're not going to navigate properly, are they? So the first thing you got to do is have accurate information. Shot? All right, we're heading down to 5-1. Trying to get into the foramen. Not sure yet. Shot. I feel like I'm a little too lateral. Shot. AP. Let's just verify on the AP. That looks pretty good. We're getting awfully close. Thank you, Luis. Now, when you're doing more than one level, you want to always navigate to the more difficult level first, which is what we're doing, L5-S1. In the lumbar spine, L5-S1 is almost always going to be the more difficult level. You see the bone spurs. Show us these bone spurs. We have a name for this. It's called DISH. And it stands for, show the one above on the right side. Diffuse idiopathic skeletal hyperostosis. Again, we're not here to deal with those. They are not causing his symptoms. Show the beak above. Look at that beak. I mean, that's just a massive outgrowth of bone. They don't need to be treated. We just need to get to the pain source, which is what we're doing right now. Is he doing okay? Yeah. Well, I'm right on his disc. So AP, this is the L5-S1 disc. You can actually see the vacuum space phenomena at 5-1 as well as 3-4. That looks really good. I mean, I don't think we could be any better than that. We got lucky here. So, is he reliable?
Yes.
Shot? Mm-hmm. Yeah, we got lucky here. Got right into the 5-1. I'm going to make my incision. This will be a 1/4 inch incision. I will need a guide wire, Luis, I think. Let's place a guide wire at 5-1, and then we'll come back and do the discogram with the needle later. But I'm going to get this needle out of here because it's all the way sunk down to the hilt. Shot. Yeah. Because I can't place my second needle here, because the body of the first needle is blocking my access, I'm going to place a guide wire instead. Sometimes we have to do this little maneuver. All right. You're fine, Jordan. That looks pretty good. So let's try to get to the next disc, which will be the L4-5. We're fixing 2 discs today, and we're fixing 6 facet joints. The 6 facet joints are causing facet pain. Our patient is celebrating his 81st birthday by getting his back fixed. Shot. 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 Looks pretty good. Where do you feel that?
Where do you feel that?
AP.
Right in his back.
In your back? All right, that's where we want you to be feeling it. That looks pretty good. That's perfect. Huh? We know that that disc is certainly painful, don't we? He almost jumped off the table. You're doing great, by the way. Everything is going well. Just relax. I need you to hold still while we finish this last one, okay? We're almost done. Shot. I've just got to navigate into this disc. Where do you feel that? Your back?
Where do you feel that back?
Yes, Sanjay.
We have a question from Fiona on YouTube.
Uh-huh.
Hi,
Hold on
Doc.
a second.
Yep.
Before I take the question, let me just focus for a second, and I'll get to Fiona's question.
Copy
I
that.
just have to get into this last disc. Shot. Just give us a second, Fiona. Let me just focus here. Shot. I want to get this just perfect. Uh-huh. That's looking really good. Yeah. That's your bad disc, huh? Yep. Shot. All right. We're just right there. We're going to have you asleep in just a minute, okay? Yeah, you're doing great. Shot? Yeah. We're almost done. I just need your help. All right, let's place the other needle. Uh-huh. Are you comfy? Any pain? Not now? All right, listen, I need your help here, okay? Yeah, I know. We expected that. I need your help. So here's the deal, Shot. I need you to tell me if you feel pain, and if so, how bad it is on a scale of 1 to 10, okay?
Give us a number.
Yeah, give us a number. You understand what I'm asking you? Are you comfortable right now? You having any of that back pain you typically have? All right, how long have you had back pain, sir?
55 years.
Lower back pain. Did something happen? For 55 years. Helicopter accident? And a car accident. He's had, folks, he's had back pain for 55 years. It's just gotten worse over the years, hasn't it? Yeah. Typically gets worse, not better. All right. Are you comfortable? How bad is that on a scale of 1 to 10?
Give us a number.
What's the highest? 10? What's the highest it goes?
7.
8. All right. He jumped off the bed. I think it's a little higher than that, but we'll give you 8. That's what he said, 8 over 10. Is that where you get your back pain?
Very often, right?
Yeah. Well, that's the L5-S1, 8 out of 10. That pain's going to be gone when you wake up, okay? We're fixing that for you. All right. So we tested one disc, L5-S1. He had 8/10 concordant. Concordant means that's the pain he gets every day. Is it better now?
Yep.
Remember, he's had back pain for 55 years. He's 81 years old. Poor man. How bad is that on a scale of 1 to 10? All right, so L4-5 is a 9 out of 10. That didn't go any higher than a 9? Huh?
9.
All right, sir, we're going to fix both of those pains, and when you wake up, they'll be gone forever. All right. Just count from 1 to 100 out loud so I can hear you count. Keep going. If you get to 100, I don't pay the anesthesiologist for the day. All right. So, for those of you watching, this is an 81-year-old man. Folks, you see how degenerated those discs are. You see the gigantic bone spurs. Keep going. The discs are completely collapsed. Yet, we're still able to figure out that it's these two discs causing back pain for him. And we're going to literally get rid of his back pain here with this one surgery where we go in and fix the tear called the Deuk laser disc repair. If you go anywhere else in the world, the surgeons are going to want to fuse you. You don't need a fusion. I used to do the fusions, and then we figured out we didn't have to. All we got to do is this little cut and go in and repair these discs in one very specific spot. And Deuk Spine Institute is the first in the world to discover this, and the first in the world to treat it, and the first in the world to publish it. It's called the posterior annular tear, and we're doing what's called an annular debridement. We've done now about 1,850 patients, and our average now of pain relief from the disc is 99.5%. That's recent data we just tabulated. All right, we'll take the questions. Dr. B, can I proceed? Shot?
We have a question from Fiona.
Uh-huh.
Hi, doctor.
Fiona, I have one question for you before I answer yours. How is Shrek? We all want to know. I'm kidding. Go ahead.
Is having a vacuum space bad?
Is having a vacuum space bad? So what I'm referring to, for those of you who don't know what a vacuum space phenomena is, it's a finding seen on X-ray or sometimes CAT scan, and it's where the disc is. And if you look up there at L3-4, Jordan, show us L3-4. You see that whiteness inside the disc space? That is a vacuum space phenomena. It just means there's literally negative air pressure in there. Nobody knows why it happens or how it happens. All we know is that it does happen. It really means nothing, except sometimes when we go inside the disc, you'll hear a little hiss as it sucks air in. Yeah. We don't know why, but I think it has something to do with like the way the bones are pushing against each other or away from each other, would say, that causes it. But nothing to worry about. It's just a finding. It's meaningless otherwise. Shot? All right, we are now entering L5-S1. Take that. Hold on. Shot? Yeah. We're inside the L5-S1 disc. For those of you who have never watched us do the surgery, the entire Deuk laser disc repair procedure is done through this hollow tube. It's 7 millimeters wide, which is a 1/4 inch. The whole surgery is done with a 1/4 inch cut. By the way, this surgery is outpatient, meaning there's no hospitalization. This patient will go back to his hotel room in about an hour after surgery. This is his birthday gift for himself, getting his back fixed. at Deuk Spine Institute. Thank you, Luis. Yep. All right. Sanjay, let's show the audience how a degenerated disc, herniated disc, whatever it is you have wrong with your disc, how they all cause pain the same way. All right, welcome back. Now you have seen how a disc can be so painful. And the way it happens is you get a tear in the back wall, called a posterior annular tear. You get herniation of the nuclear material into the tear, which then causes inflammation. The inflammation, Luis, I'm just not getting the laser fiber. There, that's better. Yeah, you got to pay attention to the details, Nikki. The details matter. Having it again. Yeah, that's better. All right. We are now inside the tear at L5-S1. Remember, this was an 8 out of 10 pain. Questions?
We have a question from Earth Body Official on YouTube.
Sure.
Hi doctor,
Hello.
do you do endoscopic surgery on hypertrophic Lushka joint in the neck that is causing neuro symptoms and ROM issues? I don't have a disc issue.
I love when patients diagnose themselves or when they believe the nonsense told to them by other people. First of all, you do have a disc issue, whether or not you want to believe it. That I can't fix, you're believing it or not. Second of all, I've never met anybody that needed surgery for hypertrophy of the Lushka joint. So you must be an anomaly, like the Loch Ness Monster or Bigfoot. We finally found you. If you believe that. What typically happens is your surgeon will show you hypertrophy of Lushka, and you will say, I'll just do physical therapy. And the surgeon will say, you can't do physical therapy, you got hypertrophy. You need surgery. So basically they're telling you that just to make you have surgery. The reality is your symptoms are not coming from a hypertrophied Lushka. They just want you to believe that, so you'll have surgery with them. Don't believe it. Do the MRI review, get a real answer why you're having symptoms. If you are a hypertrophied Lushka as the cause of your symptoms, and I'm not saying you don't have hypertrophied Lushka, you probably do, but that's not causing your symptoms. Everybody has hypertrophied Lushka, everybody. Even I have hypertrophy Lushka, standing here operating with no symptoms. Hypertrophy Lushka doesn't cause symptoms.
What exactly is that?
What it is it's the onsonate process, and it has another name, joints of Lushka. And surgeons lie to patients and tell them they need surgery for it when they really don't. So we have a victim of dishonesty. That's what we're dealing with. Next question.
We have a comment from Canes25 on YouTube.
Yep,
He says, "Happy birthday, sir. You deserve this."
that's very kind of you. Thank you. Thank you very much. Yeah, this patient was born during World War II. We were just talking about it. By the way, you see the pink? You guys see the pink tissue right there?
Yes, we do.
That's the granulation tissue that we always talk about. That's where his pain is coming from. It's not the degenerated disc. It's not the hypertrophied joints of Lushka. It's not the pinched nerve that everybody is led to believe. Come to Deuk Spine, we'll fix you. There are things that we can't fix with laser surgery. One of them is OPLL, if that is causing the symptoms, OPLL. For those of you who don't know what that is, it's ossification of the posterior longitudinal ligament. It's very rare, but it does happen. And patients that are symptomatic from OPLL, this is not the surgery for you. But we don't treat tumors with this surgery. We don't treat fractures with this surgery. But we do treat pain with this surgery. So if you have back pain or neck pain, this can be used to fix it and eliminate it permanently. This is the only surgery in the world designed to eliminate back and neck pain. There is no other way to get rid of it, by the way, your back and neck pain, besides surgery. We know all the causes of back pain and all the causes of neck pain. None of them go away with physical therapy. None of them go away with chiropractor. None of them go away, and I mean by go away, I mean permanently go away. You might get some temporary relief. They don't go away with shots. They literally, if you break down the causes of back pain, there's disc, which this patient has. There's facet, which this patient has. There's piriformis muscle, which this patient does not have. There's sacroiliac joint, which this patient does not have. There's coccyx, which this patient does not have. But if you take the most common causes of back pain, you're talking about disc and facet. This patient has both. And these surgeries we do are the only way to get rid of it. There is another option that works pretty well, and that's fusion. Fusion. But you have to fuse an awful lot of joints. And who wants a fusion? Fusion is metal in your body, fusing your spine together. It's very dangerous, and to be honest with you, completely unnecessary for degenerative problems like this. So, all right, what other questions do we have from our audience? Sanjay?
We have a question from DS on YouTube. Is there a Deuk Spine in Mississippi?
Yeah, I wish there was. There's no Deuk Spine anywhere in the world but Florida right now. We have one location. Believe it or not, we're a small company. We have a small building. We're not a giant hospital. We're a small clinic. And we just happen to be the ones who discovered, number one, all the causes of back pain, and number two, how to fix them. We just happen to be the first. He's a little light. He's moving a bit. He's just squiggling. He may be fine with you, but I'm just letting you know. He's responding a little. Yeah, we're at the outer annulus where it's most painful. So we don't have locations yet everywhere in the world. Someday we will. But right now we just have one. And that helps keep the cost down. Because these centers are very expensive to run. So if we had more, we'd have to charge more. And right now we just have the one. We're hoping to change that and add a center in Orlando in the next year. God willing.
We have a comment from Canes25 on YouTube.
Yes.
Must be quite the pleasure to fix this gentleman.
Yes, it is. You're right, Canes 25. There's no greater feeling in the world than being able to cure somebody's back pain. My father was an OBGYN. He told me the greatest field in medicine was OBGYN. Okay? And he said it was because you get to deal with patients at the happiest time of their life, when they're having a baby. And he said that the what you share with the patient is incredible. There's no other field of medicine like it, you know? Getting ready for that baby to come. He loved it. But wasn't for me. I tried. I couldn't do it. So somehow I ended up in neurosurgery. But at the same time, I was able to do something in neurosurgery that is, I think, incredibly helpful to people, which is to cure their pain. Of course, I never expected to do this when I started neurosurgery. I expected to be taking tumors out of brains, clipping aneurysms, and removing AVMs, and doing all kinds of interesting brain surgeries. But this is God's calling for me. And somehow here I am. And I did not even know that this is what I'd be doing. When I went into private practice after graduating, I thought, I'm just going to be a private practice neurosurgeon, just doing what everybody else does, you know, fusions, laminectomies, microdiscectomies. I never expected to go down this road. But as I said, this is where God led me, and I'm here. So, and you can't say no to God. So I just did what I believed was asked of me, and it is a reward to be able to cure people of their pain. Of course, we had to figure it out. You know, what causes pain? How do we get rid of it? With a lot of help from Dr. Schrumpf and Dr. Patel. And the truth is that pain has many different causes. And for a long time, we believed back pain came from muscles and that people just needed physical therapy. And then I realized after sending thousands and thousands of people to physical therapy that it didn't work. And what physical therapy does, it helps with muscles, like keeping them from getting worse, decondition. But it never took away the pain. And it only made it worse. So I realized we're dealing with something other than a muscle issue here. We're dealing with it looks like a joint issue, because fusion of the joints would take the pain away. So over the years, I started to recognize all the different causes of back pain and recognize that they required treatment other than therapy or pills, because pills didn't work either. So here we are. Fast forward 20 years. We now know what causes people's back pain and we know how to fix it. All right, this is the last of the herniation at 5-1. You see the laser's doing a really nice job of vaporizing the granulation tissue and the herniation that's stuck here. Remember how degenerated this disc was, right? Well, we're going to literally get rid of the pain from this disc by just doing what we're doing. And for those of you who don't understand just how small of an area we're operating on, the inside of this tube from side to side is about 5.5 millimeters. Right, Luis? And that fiber you're seeing, the glass fiber, it's encased in blue. That fiber is 1 millimeter. So basically, we're going to eliminate the pain from this disc by fixing an area that's around 15 millimeters by about 5 millimeters. So it's a tiny area in the back of the disc. And guess what? You're not going to see anything different on the MRI if you go and look at it afterwards. People ask me, Dr. Deuk, why don't you get an MRI afterwards? The reason is there's no reason to get an MRI. As long as the patient's doing well, we don't suspect any reherniation, there's no reason to get an MRI because you're not going to see much change. This is not a structural surgery. This is a physiological surgery. That's a little bone spur right there. For those of you who like to watch the laser go head to head with a bone spur, there's no contest. The laser is like Floyd Mayweather, and the bone spurs are like, what's his name?
Mike Tyson.
No, Jake Paul or something like that. That crazy YouTube guy. You're talking about doing a fight. The problem is, unfortunately, people like Jake Paul and Floyd Mayweather, they'll literally sell out for money. They have no value, no morals. What I'm saying is, Floyd would actually take a dive for the money, knowing Floyd Mayweather. I think. I could be wrong. Maybe that's why they haven't had the fight yet, you know? Because Floyd is being asked to take a dive, and he won't do it. Anyway, if you know boxing, you know Floyd Mayweather is basically unbeatable, but he is getting older. I hope I've not offended any Jake Paul fans. All right, we're pretty much done here. Let's take one more peek at 5-1. Looks good. There's the nerve right there. You guys see it to the left? Right there. It's in the fat. That's going to be the L5 nerve root. We're done. One down, one more to go. After we complete the Deuk laser disc repair, left L5-S1 and left L4-5, we're then going to move on to his facet treatments. Remember, he has facet joint pain. He didn't just injure his discs, he injured his facet joints. And they're full of arthritic pain. So we're going to deaden those joints, take that pain away with the Deuk plasma rhizotomy. We've been doing the Deuk plasma rhizotomy for almost 2 years now, and the procedure gives permanent relief to facet pain. Ready? All right, any questions?
We have a question from Deus on YouTube.
Sure.
So you don't think fusion is the answer?
Well, great question. Let me be perfectly clear. If you break down all the spine problems in the world, everybody with a spine problem. They fall into categories, okay? The categories are degenerative conditions, traumatic conditions, tumors, infections, and deformity. And deformity, I'm talking about things like juvenile scoliosis that kids get, where their spines twist and we don't know why. Of all those different categories of spine problems, the most common is degenerative. And it accounts for about 95% of spine problems in the world. Degenerative. Shot? Shot? So, degenerative conditions are things like herniated disc, bulging disc, degenerated disc, all these disc problems and facet joint problems. Basically joint problems. Tumors are obvious. They're tumors that affect the spine. They're rare, thank God. Then you have infections like common in countries like India, where they have tuberculosis is rampant. You get these infections of the spine. Or you have IV drug users that inject heroin and they get infections that spread to the spine. You have sometimes diabetics who get infections that spread to the spine, but infections are rare, tumors are rare, and then you have motor vehicle accidents. Okay, fracture dislocations. You're traveling at a high speed, you get into a car accident, and you have a spine injury, and the spine gets fractured. Okay, and those are, thank God, kind of rare. So the most common condition affecting the spine in humans is degeneration, degenerative conditions, which is your degenerative disc disease, herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, all the usual stuff. And that's what this patient has. And for these patients with degenerative conditions, you do not need a fusion. I used to believe they did. I was a fuser. I fused everybody, and it works. It works really well. You're okay. Wait. And then I realized you don't need to. You don't need to fuse these patients because we can fix them without fusion. Yeah, it's not good.
We have a response from DS on YouTube. He says,
Hold on a second.
Yep.
Let's get him more relaxed because I don't know if we're going to be able to get this tube in the way he is right. He's pretty tight. So fusion is not necessary if you know how to do this surgery. Deuk laser disc repair. All right. He's pretty collapsed and tight right here. Let's see what we can do. That may be the best I can do. Let's try to get that out. I wouldn't use that. No. I don't think you're going to have enough of that to pull out. Okay, you got something going on here. Just, you need to be watching this. Is it turning at all? A little bit, no? Yeah, get a vice grip in case we need it. No? Did it move at all? Shot? Doesn't look like it, huh? I don't think hammering it in further is going to help. This sucks. We're going to have to vice grip it up probably. All right, while we work on getting the dilator out because it's stuck in there, let's take the question or comment.
We have a comment from DS on YouTube. He says, I have the same problem as the gentleman you're working on.
Yeah, I think the sleepy helped. Well, come to Deuk Spine Institute and get your back fixed. That's the best advice I can give you. Don't screw around with other surgeons who want to do all kinds of devices that don't work, okay? We've tried everything, folks, and I'm just being honest with you. The only other thing that works is a decompression infusion, and that's with Smith-Peterson osteotomies. That's basically where I have to go in and cut bone out. Let's get the laser. And the bone you're cutting out, by the way, are the facet joints. They're hypertrophied. So it's a massive surgery. It's very, very aggressive, but it works. So other types of surgery really don't work. Now, people will tell you, I had a fusion, I felt better for a little while. The reason they felt better for a little while is because the doctor, they basically gave them some steroids to feel better for a little while. And then their pain comes back after a few months. You hear it all the time. My advice is avoid the fusions. Avoid the invasive surgeries. Come to Deuk Spine. There's probably, I would say, at least 100 treatments out there today that doctors can offer you for your back. And 98 of them out of 100. Look at that herniation that just came out. Look at this, Sanjay.
Yes, Dr. Deuk.
Literally just came out. You see this?
Yes, I do.
Can you see the metric thing?
Yes.
Don't move. Look at the red, the granulation tissue, the inflammatory tissue. You see it?
Yes, I can see that.
All right. Good job. So out of 100 treatments out there, we're talking about intercept, we're talking about, fusion, artificial disc, laminectomy, discectomy, spinal cord stimulators, morphine pumps. The list goes on and on. 100 treatments, only 2 of them work. The Deuk laser disc repair and the proper fusion. And I mean proper, which you're not going to get from most surgeons. They don't know how to do a proper fusion. Thanks. So if you go get a fusion somewhere else, there's only about a 10% chance it's going to work for you. Now, if I did a fusion on you, there's a 100% chance it's going to work, because I know how to pick the fusion discs that need to be fused, and I know how to do the fusion the right way. There are so many wrong ways of doing a spinal fusion. The biggest problem is a lack of decompression, which is the osteotomies I was telling you about, and a lack of reconstruction to put the alignment of the spine proper with the fusion. Because if you think about it, fusion just means you're fusing bones. It doesn't speak at all to decompression. It doesn't speak at all to realignment. But if you're needing a fusion for your back pain, that means your spine is out of alignment. And if the surgeon fuses you out of alignment, which they all do, by the way, then you're going to be in more pain and you're going to get adjacent segment disease. We're almost done. About another minute here. And then we're going to move on to the DPR. You ready, Jordan? Great questions. So fusion is no longer necessary, and the best treatment in the world for back pain is the Deuk laser disc repair. And that's why you're going to want to travel to get it done right, where it was originated, here in Florida at Deuk Spine Institute. All right, I'm going to wrap this up. See how collapsed this is, but we still got the source right here. We've treated it. We even pulled the big herniation out. We're done. And I'll keep taking questions. You guys have been a great audience. So far, our patient's procedure is going very well. Our next patient is a cervical Deuk laser disc repair. Now she has an unusual herniated disc at C7T1. Normally we can't reach those, but when I looked at her x-ray, I see a way to get there from the front. So some people's necks are long and skinny. Hers is. So we're doing her case next after this. Did we save that dilator or not?
Yeah, we can.
Oh, nice job. Move out of the way. All right. At this point, we've completed repairing the two discs. Now I'm going to move on to the facets.
Just punch you up.
Huh?
No. Need to
Mm-hmm.
I don't know.
Any questions?
We have a question from Janet on Facebook.
Uh-huh. Shot?
What does it mean, and what is the treatment for a slipped vertebrae?
What is the treatment for a slipped vertebrae?
Yep.
You don't need a slipped vertebrae to be treated. The slipped vertebrae don't cause problems usually. What you need is to get rid of the pain. And a lot of people don't understand, to get rid of the pain, you need a treatment that's going to get rid of your pain, not a treatment for a slipped vertebrae. Shot? The problem is a lot of doctors have convinced patients that they need treatment for a slipped vertebrae, such as a fusion. But you don't. They're lying to you. Don't believe them. We treat slipped vertebrae all the time here at Deuk Spine with this laser surgery, and we take people's pain away every single time. So how is that possible if we're not treating the slippage? That's because the slippage is not the cause of the pain. It's obvious. And that's why there are so many doctors that disagree on whether a slippage needs to be fused or not. Shot? My opinion is it does not need to be fused. Shot? Now, if I'm going to go in and if I'm going to go in there and do a decompression surgery where I'm taking the bone out, then yes, you're right, you need a fusion. But if you're not going to do a decompression, then you don't need a fusion. And you don't need to do the decompression, usually. All right, Jordan, what do we got here? Have we been moving around a bit? Shot? It's really hard to see. If you can just give me a little bit more view. Shot? Yeah. Thank you. Shot? All right, it looks perfect right there. Now this procedure, we're actually killing the pain nerves to the facet joints that are full of arthritis. We call this a Deuk plasma rhizotomy. What it really is a rhizotomy. A rhizotomy is a procedure where we destroy the pain nerves to the arthritic joints. Perfect. One down. Move on to the next one. I may have to make a separate incision. I'll try to get one more. Shot. Looking good. Now this procedure you're watching, we've applied for a patent because we're the first in the world to do it. And it's called the Deuk plasma rhizotomy. Shot. All right. I feel the transverse process. I don't feel it anywhere else above. That's got to be it. Shot. That looks really good. We've been doing a lot of these procedures lately. They work amazingly well. By the way, we've also completed our first 2 piriformis muscle releases. Both patients have 100% of their piriformis pain gone. All right, let me think. I've got to do the next one at 5 and then S1. So I'll try. It's a long reach, but I may have to make another incision. Shot? Yeah, I'm probably going to have to make another incision. Huh? Shot? Shot? That's beautiful. Any more questions, Sanjay?
We have a comment from Samir on YouTube.
Uh-huh.
Doctor, I did the MRI review and sent the documents back. Waiting to hear about the next steps. How
Wonderful.
long is it the wait?
If you did the MRI review, you should have heard by now from somebody. So I would reach out and find out who is supposed to contact you. Talk to the MRI review people that you've been communicating with. But somebody should have reached out to you. Shot? Contact our MRI review at dukespine.com. That way Luis can close up the other side. All right, let's see what we got here. Shot. We've now completed the procedure. There's 5, there's 1, there's 4. It looks like I'm on 3, right? I think so. It's just above the beak. Shot. Anybody ever gone up to Stanford? Shot. Looks perfect. No, Stanford here in Florida, just north of Orlando.
Sanford.
Sanford. I apologize.
Sanford is in Connecticut and also in California.
Yeah. Sanford. There's a German restaurant there we went to. It's amazing. If you ever get a chance,
What's the name of it?
it's a bit of a drive. The name. Oh, you got me on that one. I think it's the only German restaurant in Sanford. I forgot the name.
My mom loves that.
Oh man, it's good. It's really good. And they have entertainment. The schnitzel's amazing. It's really good. Shot? Yeah. And the pretzels.
How far is Sanford?
Oh, it's an hour and a half maybe. Hour and 20 minutes.
Do they have an airport there also?
Yeah, they do. Shot? You know what's interesting about Sanford? I've sort of learned a little bit about the history. Is it's connected to this chain of lakes that people used to use as a trade route for northern Florida. And they used to bring goods down this lake, down these lakes from central Florida. And as a matter of fact, I think it almost connects by lakes the east and west coasts of Florida. Huh?
It must be
Yeah, that's it. Holler box. Holler
A
bar.
lot of rave reviews on that.
Oh man, it's worth the drive. Holler box. Yeah. You know, it's fun. It's something to do. They actually have a garden there, up there. They have a lake too, but it's nice if you can walk around the garden. There's a zoo. I think it's a zoo, Sanford Zoo. Anyway, we went and saw these lights. These lights in the zoo. Whew. All right. Just about done here. I need another minute. Hold on a second here. Shot. Got to get down to 5. There's some really thick fascia or something. There we go. Shot. All right. Yeah, he's got very thick fascia. Shot. Any more questions, Sanjay? Shot.
No questions.
Just about done. If there's no questions, I'll come and answer them. Folks, type up your questions for me. Happy to answer them. I'll do it face to face. Trying to get a little more medial, but the facet is so big here. I'm just not able to. Shot, let's see how medial I got. Actually, it's pretty good. All right, and then the last one, shot. 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 That looks really good. All right, type up your questions for me. I'll come and answer them. But this patient's surgery went very well. I think he's going to do fantastic. So. Sanjay, let's show the audience how the Deuk laser disc repair works, if we haven't done that video.
Playing educational.
Hey, good morning. I'm Dr. Artie Majan, CEO and founder of the Deuk Spine and Deuk Joint Institute. I'm here with a patient who's traveled from Pittsburgh to Florida. And what brought you here to the Deuk Spine Institute?
Well, I have had back pain for so long, and anything and everything we did didn't help. My wife did significant research. We found you online, actually, is how it started.
Excellent. And what kind of procedures did you have done before you came to Deuk Spine?
I've had 5 lower back surgeries, 1 fuse, and the others laminectomies and so on, all within the last 3 years.
And they were recommending another fusion for you, weren't they?
They were. That's when I really began to research other options. When they mentioned another fusing, I absolutely was not going to do that. So that began a research that ended up finding you.
The Deuk Spine Institute. And what we do differently, folks, is we cure pain with one procedure. Patients don't have to keep coming back having multiple procedures and pain management. And that's kind of where you were. You were in that surgery, pain management, surgery, pain management, surgery, pain management, back and forth. And that goes on if you keep doing it for the rest of your life. But you found a way to get out of pain and you came to Deuk Spine. How do you feel today?
Unbelievable. I have not felt this good in years, several years.
And you feeling good because we put you on some new pain pill that nobody else has?
Absolutely not. I've lived on pain pills up to this point. I'm on nothing. I have a prescription for some muscle relaxers, no pain pills. I'm on nothing.
And how did Deuk Spine Institute fix your back?
Had the L3-4, L4-5 laser surgery, and then the rhizotomy that was done a few days later. A combination of those two, I'm pain-free.
Yeah.
I'm really pain-free.
I'd just like to point out that you, like many people, had more than one source to your back pain. You had discs that were causing the back pain, facet joints that were causing the back pain, sacroiliac joints that were causing the back pain, I think a piriformis that was causing the back pain. And because you were walking so funny, you were getting bursitis and other pain in your leg from the iliotibial band. We had to identify every one of those sources and treat everyone properly. And once that was done, it eliminates the pain permanently.
I have dreamt of feeling this way for years. Teared up a little bit this morning when I woke up. I could get out of bed without holding on to the wall, or it was just an incredible feeling.
Well, I'm very happy for you, and you could see we did your surgery with the laser, cleaning out your discs. Where did you go for your spine care? Was it a good center?
Prior to coming here,
Yeah.
I was at two major medical facilities in Western Pennsylvania and Eastern Ohio. Went through a lot of pain with the different procedures and surgeries I had done, and had no relief.
And what were these other facilities, you can say?
UPMC and Cleveland Clinic.
Yeah, two of the top spine institutions in the world, right?
Yes.
Great reputation,
Yes.
and yet they couldn't get you out of pain.
No.
And they were just ping-ponging you between surgery and pain management, surgery and pain
That's
management.
exactly what happened. Yes.
And there's no hope for actually getting cured because they don't have the cure to back pain. We do. Unfortunately, we've been trying to share that cure with them, but they're not interested. They just want to keep doing fusions because, well, let's say it, fusions make a lot more money than laser surgery does. It's hundreds of thousands, if not millions of dollars over your lifetime. That said, I'm glad you're doing well. When are you guys heading home?
Getting on a plane in a couple hours.
All right, very good. Is there anything you want to tell people out there in final remark?
I would just say that Deuk Spine Institute has been a lifesaver for me, literally. I would highly recommend it. I was being ping-ponged around for 5 years. I have dreamt of feeling like I feel right now for a very long time. So I cannot thank you, Dr. Patel, your entire staff. Everybody's been just incredible.
That's what we're here for, my friend.
Thank you, Doctor.
Give people back their lives.
Yes, thank you, sir.
All right, now go enjoy your Top Golf.
I will now. I will now.
All right, let's get you out of here. We're here at the Deuk Spine Institute. I have a patient who traveled from Ohio to Deuk Spine Institute for his lower back. And he's been through a lot of treatments in the past that didn't really work. They may have given him some temporary results. I'll let him tell you more about that. But he's here today, a new man, just 24 hours after his outpatient surgery. He had the Deuk laser disc repair. You can see in the video we made some small cuts on his back, went in through a natural opening in the spine called the neuroforamen. We didn't do any damage under the skin, and we were able to repair the herniations that have been plaguing him now for years. How long have you had problems with your back?
Since approximately 2009, quite a while.
All right, so about, what, 14 years now?
Yeah.
And you've had surgery before. How were those other surgeries?
I had two minor surgeries. One lasted for about, relieved my pains for 3 years. Second one, maybe 6 or 7, somewhat of the pain, enough to get me through. Over the last couple of years, the loss of balance, which really affected my job, was just getting worse and worse and worse. I really didn't know what to do. And I went through 3 local surgeons, and everybody, the only answer was fusion, fusion, fusion. That was pretty much going to end my career. So
Yeah.
I found this guy.
And you had surgery yesterday. How are you feeling today?
Besides just a little bit of soreness in my back, the balance is back. I know I'm on a way to recovery.
You look a little teared up there. Yeah? It's been a journey, hasn't it?
As soon as I did the video conference with you, sort of broke down like this too. So hoping
I understand.
they'd be back.
So can you tell the difference at this point now that you've had the surgery?
Oh yeah.
Yeah?
Yeah.
You said you got up and you walked straight this
That's
morning.
I haven't been able to do that for over a year without falling. I couldn't walk down a hallway without
Yeah.
grabbing the walls.
And the reason for that, your nerves were getting pinched pretty bad. And we went in there and unpinched them during your surgery with the laser. And we did not have to do a fusion, and you're not going to need a fusion. That's the great news.
Yes, it is.
And is there anything else you want to tell your fans out there?
I just hope more people that these doctors are only giving them that option, fusion. Come see this guy and don't ruin your life.
When do you head back?
Sunday.
Sunday. You're going to enjoy Orlando for a little
I'm
longer?
gonna try, yep.
Yeah, all right. We'll try to make it out to the Space Coast and go see the rockets over at the Kennedy Space Center. It's pretty cool over there.
Okay.
All right, sir.
Thank you, sir.
You're welcome. My pleasure. Let's get you guys out of here. Come on. Okay. You see here in the surgery that we've just completed in our patient whose birthday is today. He's 81 years old. We did 2 discs. We repaired both, even though they were severely degenerated, and he had DISH, diffuse idiopathic skeletal hyperostosis. We call it DISH. Has nothing to do with their pain. So don't get distracted. A lot of surgeons are going to say you have bone spurs, you need a fusion, but you don't really need a fusion. You just need to get rid of your pain. People don't go to the doctor and say, I have bone spurs. People don't go to the doctor and say, I have spinal stenosis. People go to the doctor and say, I have pain. And pain is in my back, or the pain is in my leg. And, oh, who bought me something nice? Who is that from?
Treasure box.
And a shower film,
Ah.
shower lamp.
All right.
It's very cute.
Christmas gifts are coming in. Thank you. Long story short, people go to the surgeon or doctor because they're having pain. The pain limits their functionality in life. Everybody wants pain gone. Whether it's back pain, pain down the leg, weakness, numbness, tingling, pinched nerves, they want those symptoms gone. Our procedure gets rid of the pain and the leg symptoms, but we don't have to take bone spurs out to do that. We don't have to open you up and fuse you or do a microdiscectomy. Those treatments are old treatments. They're highly invasive and dangerous and unnecessary. What you're watching is state-of-the-art spine surgery. Endoscopic transforaminal lumbar surgery. We also do the same procedure for thoracic problems and cervical. We're about to do a cervical next. Our next patient has a unusual herniation. If you look at her neck, she has 5, 6, 6, 7 are basically fused, and she has a disc rupture below. I think she was in a car accident which caused that. And we're going to go in and try to fix that 6, 7 disc herniation. Questions?
In reference to the slipped vertebrae, we have a comment from Janet Parker on Facebook.
Sure.
They are telling my daughter-in-law needs a surgery. I told her to please consult with you because you are the only one that does it right, and
Yeah.
will be honest with her.
You are correct, Ms. Parker. I will tell you this. For many years, I told my patients that had a slippage, spondylolisthesis, I told them, you must have a fusion, because I truly believe that. I was told the same thing, taught the same thing in my training program by my faculty, okay? That's really what we believed to be true, and we literally believed it to be true. And if you do a fusion on a spondylolisthesis, if you do it right, you can get rid of the pain. The question is, do you need to do a fusion? And 20 years ago, I would have told you, yes, you have to. But I didn't know how to do the endoscopic surgery you just watched. Now, I know 100% you do not have to do a fusion. You don't even have to do open surgery. You don't have to fuse it. You don't have to do anything with the slippage. The truth is, in the last 15 years, there's been a huge debate about spondylolisthesis and whether or not it needs to be fused. And this is by surgeons who don't know how to do the Deuk laser disc repair, what we just performed. These are surgeons who only know how to do open surgery. And there's a debate, and it's half of them say you need to fuse a spondylolisthesis, the other half say you do not. I was in the half that said you have to fuse a spondylolisthesis because fusion was all we knew how to do, and that is the only way to get rid of the pain there. Okay? Plus, with spondylolisthesis, the nerve roots are being pinched in the foramen. So you have to go in there and you have to take bone and ligament out to unpinch the nerves and put a cage in. And when you do all that, it's only going to make the slippage worse. So you have to fuse it to stop it from hurting. Now, a lot of surgeons believe you don't have to fuse a spondylolisthesis, but let's get past all that argument and deliberation. The reality is, the surgery you just watched, the laser surgery, we go in there and clean out the tear. That gets rid of all the back pain, and we can unpinch the nerves so you don't have any leg symptoms from the pinched nerves. You don't need to fuse the spondylolisthesis. She does need to come to us. We're the only place in the world that can fix her without having to have a fusion and decompression.
The next question comes from Jamie Franklin on YouTube. Since pain tells our brain that something is wrong, why is a rhizotomy good?
That's a great question, Jimmy Franklin. You are correct. Pain tells our brain something's wrong. The problem is when that pain becomes so distracting that you cannot live a normal life and that your entire day is controlled by pain. Then the pain is not helping you to tell you there's something wrong. It's true that acute pain doesn't mean it's cute like a little bunny. Acute pain means pain that is there for a short period of time, usually hours or days. Acute pain is very helpful. We need to know if there's a problem. You know, if you have appendicitis and your belly hurts, you need to know your belly hurts, there's something wrong, appendicitis, you need to get it fixed before you die, all right, before you burst your appendix and die from infection. Point is, when you have chronic pain is pain that never goes away, and it's disruptive to your normal life, and it serves no beneficial purpose. So a rhizotomy is the best way to fix facet joint pain. And it's not just any rhizotomy, because all the other rhizotomies that are done out there are temporary, but the Deuk plasma rhizotomy, we're the first to discover it. It's a permanent rhizotomy. It takes the pain away permanently. That helps improve the quality of life. What your pain is telling you is you have arthritis. Once you know you have arthritis, there's really not much else you need to know. You just want to get rid of that pain.
The next question comes from Earth Body Official on YouTube. Doctor, my CT scan report says hypertrophy and I can see the encroachment in the foramen. Haven't spoken to the surgeon yet, but I feel the nerve catching on something. What can be done?
Well, first of all, thanks for commenting. And you're talking about hypertrophy, you're talking about the nerve catching on something. What you need to do is do an MRI review so I can figure out why you're having your symptoms. And then I'll tell you exactly what needs to be done. Without doing an MRI review, without talking to you about your pain, it's impossible for me to know. Yes?
The next patient was asking me to ask you. She's here with her elderly mother, and I guess she doesn't want to drive back for the follow-up. She said in 2016 she doesn't.
It's fine, she can just
I just
go.
wanted to check with you.
Thanks.
Okay.
All right, so that should have answered that question.
The next question's from Earth Body Official again. I saw an NIH article on posterior endoscopic foraminotomy to remove bony growth at or around Luschka that is causing problems. Could you do that?
An endoscopic foraminotomy around Luschka that's causing bony problems. Yes, I can do it. I know how to do the surgery. No, I will not do it because I only do surgery that I think is necessary, and I do not believe that's necessary. So go find another surgeon. You're clearly a very stubborn person. You have no clue what you're doing, and I have no interest in helping you. I only want to help people that understand why I do what I do and trust my judgment, not people that come in for a McDonald's cheeseburger order. We're not a fast food restaurant. You don't show up and say, do this surgery for me, Dr. Deuk. I don't work that way. I only do surgery that I know is going to be beneficial to my patient. And drilling foramen of Luschka or Luschka joints is not beneficial, ever. So go and find another surgeon.
The next question comes from Yin Yang Yu on YouTube. Could the arthritic facet cause decreased range of motion?
Could the arthritic facet cause decreased range of motion? 100%. When you have arthritis in your facet joint, it causes a decreased range of motion for two reasons. Number one, pain, if there is pain. And number two, the arthritis builds up soft tissues and bone spurs that restrict the movement of the joint. So you have a physical restriction of the joint due to the arthritic material around the joint, and you have pain that functionally limits movement. We can treat the pain that functionally limits the movement. That's the most common problem people have. People don't complain about the physical restriction of the facet joints ever. It's not important. It's not something that needs to be treated.
The next question comes from Stephen Williams on YouTube. I have workers' comp claim open and have had provided my private insurance as a backup. You and I have already had our Zoom MRI review. I spoke with Richard and Becky already and I'm waiting. To get on your schedule, how much of a deposit do you require to get started, and would you need a deposit for this?
Yeah, great question. So I don't deal with the deposits. Asking me is not going to help you in any way. You need to ask Richard. Richard is your scheduler. Richard could tell you how much of a deposit you need to put down.
That's all for the session.
All right, very good. Well, thanks for joining us. Our next case is going to be a cervical one level C7T1. This is a patient who was in a car accident. She had a whiplash, got rear-ended. She herniated the disc. Now she has pain at C7T1. We're going to go fix one disc. Thank you for joining.